What we use are digital x-rays. That's beneficial because we can take the x-ray immediately. The patients can see it up on the screen, so they're involved in their treatment. It's just a few seconds, it's there. We can blow it up larger so they can see. If we see an area, I can explain to them their periodontal health, which is their gums, how healthy their gum tissue is by looking at their bone levels with them, things that they've never really been able to understand or see before. We use an intraoral camera, so if the patient comes in and says, I think I chipped a tooth here or something's hurting here, we just take the camera, go in there with it, it zooms in, and then they can see it up on the screen, what they were feeling, so they can put a visual aspect to it. People have different fears and anxieties of dentistry, either stemming from being a child, having a problem, or growing up, someone not listening to them in their experience. We try to find out right away how they're feeling, what they're comfortable with, and I let all the patients know I use topical, I don't want them to hurt. We use the nitrous oxide, the laughing gas, for any of the patients. Some bring their iPhones and listen to their music. Whatever it takes for us, we don't mind, to let their experience be more comfortable and enjoyable. In fact, most patients leave just amazed at how easy the experience was. We really strive at this office to make it family-oriented, comfortable. The patients, any anxiety and fears, we work very hard to relieve. We've had patients that when they first start, we're holding their hand, helping them through it, but then after a few more visits, they're coming in laughing, sitting us down, telling us about their vacation or their family. And so we work very hard to make sure the patients are comfortable.